Hello, my name's Melanie Robertson. I'm Assistant Director of Nursing at South Tyneside and Sunderland NHS Foundation Trust. I have a role as Lead Clinician for Cancer for the organisation, and I work clinically in oncology in breast cancer. I'd like to talk to you today about stratified follow-up. This is part of a personalised care package that we offer patients when they get into the end of their treatment, and there is another video that you might want to refer to around personalised care which will tell you some of the other elements in more detail. At the end of your treatment, we want you to get back to normal life as soon as possible, and we will see you in an end of treatment appointment where we'll talk about the different options for follow-up. We may talk about clinical led follow-up, which is often part of a clinical trial when we see you at regular intervals, or if there are any other specific things that we feel that we need to keep under close review. But we also have something called self-supported follow-up. Now, we understand that you know your body far better than anybody else, and you know when there's something that you should be concerned about, and we really want to see you as soon as possible when you have any concerns. But what we don't want to do is see you on a regular basis and increase your concerns unnecessarily. We'd rather see you when you really needed us. So I'll talk you through breast cancer particularly as a pathway that I know more about, and your clinical nurse specialist would be able to tell you about any self-supported pathways that were available in different cancer tumour groups. So within breast cancer, it's important that we do annual follow-up with a mammogram once a year for the first 5 years. But otherwise, we've found when we see patients on an annual basis that we don't necessarily get a lot of value out of that. Patients often don't have any concerns at all at that appointment, yet have taken time out of their busy lives to come down and tell us that they have no concerns. When patients do have concerns, I wish I'd knew about those earlier, because I don't want you to sit at home worrying. I'd much rather hear about the problems as soon as they start to bother you and do something about it, or simply reassure you at the time. So we started to look at self-supported follow-up. So we've taken the opportunity to redesign that pathway, and we work collaboratively with the Queen Elizabeth and the breast care nurses there. We offer patients the phone number to contact their breast care nurse specialist should they have any concerns. The nurse specialist can refer to the Macmillan Information Centre for counselling, complementary therapies, welfare advice, or any other things that you may need. Or they may signpost you for investigation and make referrals to the breast surgeons or back to oncology if you have any concerns about your medication or any other problems that require investigation. So we work as a team to get you to the right place as quickly as possible, and in doing so, in cutting out some of those unnecessary visits where patients haven't really had an awful lot of value, it means that we really are able to see you as quickly as possible. I really must stress that the importance of self-supported follow-up is you knowing your body best, and we absolutely do want to hear from you if you have any concerns at all. We don't want you sitting at home worrying about things. So this is not about seeing you less often, it's about seeing you when you really need us, as soon as possible, in order to best support you. So with regard to your follow-up, if you speak to your cancer nurse specialist, she will be able to explain what follow-up options are available to you for your particular cancer type, whether this be clinical led follow-up or self-supported follow-up. They'll be able to advise what options might suit you best.